Hi, this is Dr. Dan Press. I am coming from just outside of Chicago at Park Ridge Vision on behalf of the Vision Help Group, and I'm going to be discussing children screen time and specifically how it relates to myopia. Myopia, before we get started with any of the specifics, I want to make sure that we're on the same page, is also known as being nearsighted. What we are trying to describe is that near vision is still relatively clear compared to distance vision. And what we're showing here is a simulation of what it would look like when you're looking at an eye chart from 20 feet away if you have normal visual acuity relative to if you develop approximately 1 diopter, 2 diopters, and 3 diopters of myopia. And what you can see is that the distance vision gets relatively blurry, but keep in mind that children's vision up close is still clear. This makes it challenging because it is not in order to diagnose or even as a parent to recognize this, because a child doesn't wake up one day as having 3 diopters of myopia. It is a very slow and gradual process. And most of the children's visual world is close relative to far. So they don't have symptoms close, even though something is changing, which is why it's important to get eye exams. Now, the reason children become myopic is that there is an error signal in terms of how the eye is growing and developing. The eye growth is normal in all children, but it should match up with the optics of the eye in order for light to be focused onto the back of the eye. When you develop myopia, the eye grows relatively too long, so now the light that's coming into the eye is no longer focused on the retina, which is the tissue in the back of the eye, and things are blurry far away. If you put glasses or contact lenses on, it refocuses the light to the back of the eye so that you can see clearly, but we're not addressing what's causing the myopia in the first place. Myopia is not simply about blurred distance vision. My colleagues are going to be talking about in other sections other ways that screen time is affecting our youth and our children. And myopia is probably the most obvious symptom or sign that something is awry. But by itself, it's still not that big of a deal because you can wear glasses and contact lenses and see more clearly. The concern is the rates of myopia are increasing. So we're seeing it's significantly higher rates of myopia than we were a generation ago. And the levels of higher levels of myopia are increasing. The concern that we have with that is the higher the degree of the myopia, then the more at risk there is for serious eye disease as time goes on. So what this chart is showing us is that there is the global prevalence of blindness in the year 2000 versus what it will be in 2050 if nothing is done about it. And then this is a bar graph showing similarly how the youth today, as they grow up with higher and higher prescriptions, are much more likely to develop these serious conditions as they get older. So this begs the question, why? And I don't think it takes a rocket scientist to realize that the visual environments that our children are are living in are very different than what they were a generation or two ago. Screens are ubiquitous in our lives now. Children are being introduced to screens much earlier. And while genetics definitely play a role in determining your child's prescription, it has been shown in research project after research project that the environment plays a significant role. All we have to do is put a lens in front of an infant, and it will absolutely change how their eye grows. If you develop a primate, like a monkey, in low lighting situations, it's going to change how their eye develops, and they're more likely to become higher levels of myopia, than other animals that are developed in natural lighting. So we know that changing how light focuses on the eye and lighting in general plays a significant role in how somebody's prescription is going to develop. When it comes to screen time, this is something that is showing, there are studies that are showing more and more conclusively has a direct effect on the levels of myopia. So there were two studies published just in 2021, one that showed that children between the ages of 6 and 8 years old had an increase in myopia through the COVID-19 lockdown. And another study most recently showed that Dutch teenagers had an increase in the level of myopia that was correlated with using screens consecutively for more than 20 minutes without taking breaks. Now, this is nothing new. In optometry, we were aware of this. One of the leaders in our field, Dr. Elliot Frost, published a book called Stress and Vision back in 1988 that outlined the concern of this stress from staring at screens and its impact on visual development. Now, the human visual system was intended to help us navigate our three-dimensional environment. And when we spend our impressionable childhood looking at two-dimensional screens and limit the opportunities to navigate a three-dimensional environment, we're going to see changes in how our systems respond. And we're starting to see that directly with myopia or nearsightedness. But we're also concerned with how this is going to impact our children's development when it comes to their cognitive skills and their social skills and even their emotional skills. So this is definitely a discussion that is broader beyond just nearsightedness or myopia. This is a meme that I started seeing about 3 or 4 years ago that I thought was very true. You know, back in the 80s and 90s, and before then, you'd have to drag your child inside in the summer in order to get them to stop playing outside. And now you've got to drag your children outside in order to stop getting them to be staring at their screens. Now, screens are not going anywhere. And so we look at our job as we are trying to do everything we can to offset the influence that these devices are having on our children. Now, there is something that we can do about this, which is great. But what we're dealing with an uphill battle. Educationally, across the globe, we're using more and more software and technology to teach our children. And then beyond that, iPhones, iPads, smartphones of all kinds are developing apps that are made to be addictive. They are looking to create this environment that the user just wants to keep coming back for more. These social media apps, these game apps. It has been shown that there's a neurotransmitter called dopamine. We get excited every time we have a neurotransmitter dopamine released. It feels good. And these apps increase the levels of dopamine, which is the addictive type of neurotransmitter. So these are very serious discussions, again, beyond just the myopia discussion. We know that light levels, as I talked about before, have a significant influence on prescription development and child visual development. So we encourage our children to get outside as much as possible. So you could talk to them about the influence of light and how important it is. When that doesn't work, then you just go Arnold Schwarzenegger on them and yell at them to get outside, take away devices, and encourage them to play outdoors. As I said before, there are things that we can do about this. If your child does develop myopia, despite your best efforts at limiting screen time and encouraging them to be outside, there are treatments that can help slow down the rate of progression. So encouraging these behavioral and environmental modifications are very important, and we'll talk about that to finish up on the next slide. But if your child does develop it, we want to know, how can we slow it down? Because what we see is that once a child develops myopia, it tends to progress and can progress rapidly. So there are a number of treatment options that your eye doctor may have available to them to help slow that down. One of them are these specialty overnight contact lenses. We refer to them as corneal reshaping lenses. And the child will wear these lenses to sleep, and it will gently reshape the cornea. And when they take the lenses out in the morning, they can see clearly all day without relying on glasses or contacts. It has an optical effect that not only allows them to see clearly, but it changes how light is being focused in the eye in order to prevent eye growth as rapidly as the eye would change if they were wearing regular contacts or glasses. There are also specialty soft lenses that can be worn daytime. There are eye drops that are currently available, and there are also eye drops that are being developed to help slow down the progression of myopia. Bifocal glasses have a place in helping to slow down the progression of myopia. And then they are developing specialty lenses that are not necessarily bifocal. That's what's down here in the bottom left corner. That has a different type of optics that is showing promise at slowing down the progression of myopia. There is not one treatment that's going to work for every child. It depends on a number of different variables, and this is a conversation that you should have with your eye doctor. The other treatment that is possible, if there is a sign of visual stress that's affecting how your child's eyes are focusing and working together, then vision therapy is another treatment that can help alleviate the visual stress outcome of excessive near work or a maldevelopment of visual skills. So these are treatment options that you should know are available to you, and you should discuss it with your eye doctor. If you have further questions, then the Vision Help website is going to be a good resource, as is the website for the College of Optometrists and Vision Development, which is covd.org. You can't change the genetics of a child or a person, but you can change the environment. So what we recommend is, as we said before, limit screen time. When a child is required to use screens, keep in mind the 20-20-20 rule, which is after every 20 minutes of looking close, a child should take a break and look at something 20 feet away for at least 20 seconds. Now, that's been around for many years. The difference is that we believe that you need more than 20 seconds, and we believe that you should be getting up and moving. Again, vision is a system that helps guide movement. And so if you're sitting in a chair and you take a break and just look up and look at something 20 feet away, that doesn't necessarily change how vision is being utilized. So I recommend to our patients to get up and actually walk around. Ideally, you'd walk outside, but every 20 minutes, take a break, let your focusing system relax, let your brain use vision for what it's intended for, and then you can go back to doing the work that you needed to get done. Further, in terms of changing the environment, have good lighting. Good lighting is very important, even indoors. Try not to read in a darkened room. And then if myopia does develop, that's when you want to talk to the doctor about ways that we can help with limiting the progression over time. I appreciate your time. There are some resources, some references to research that we use to help put this together. You can pause this and take a screenshot if needed. And if there is are there any other questions or concerns, I'm happy for you to reach out to us through the website. Thank you for the time. Enjoy the rest of the day.